very special guest. Millie is on the line today. She's one of our Twitter followers, and I've always said to you, if you want to follow us on Twitter and get in contact, I'd love to speak to you. But this is a very special lady who's going to tell me about her splendid work that she does. So, Millie, welcome to the show.
Hello, John. Well, actually, I have to admit, I haven't signed up to you on Twitter yet. I don't think, have I? Oh, yes, I have. That's how I found you. Sorry, getting really confused now. I'm thinking that we emailed each other first.
Only via Twitter.
Yeah, anyway, I'm Millie. My name's Millie Keeve, and I founded a charity which is called April. And April actually stands for Adverse Psychiatric Reactions Information Link. And the reason it's called April is because my daughter was born in April, and my daughter died 17 years ago, Karen. And I won't go into all the details about what happened, but she suffered from adverse reactions to everyday medicines, including drug for a bowel problem, hormonal problem, anesthetics. And I was always a bit confused about why she was fine in between having adverse reactions, including a full psychotic breakdown, which was the first time there was anything wrong with her, which was just a little while after starting on a sulfonamide drug. And she had terrifying nightmares, which was an early warning sign of the impending disaster, which didn't take her life, but it took part of her existence. She was at university. She was 20 then. She died when she was 30. Now, that's enough about Karen, because you can read about it on my website, which is www.april.org.uk. And basically, I started doing research into what had happened, and I was suspicious of these drugs causing these problems, and wondered why doctors didn't seem to be really very well aware of the early warning signs, which if they had been, I think we would have still had Karen here. So anyway, I started doing the research at the British Library Medical Department, and when I realised there was a big can of worms to open, I thought, well, that's what I've got to do. So I stopped everything else that I was doing in my life and focused on trying to create awareness. And I'm really pleased that you've got your radio station starting up, because I think it's a great opportunity to share information. And also I'd like to hear from people, to perhaps discuss things, because when I did a broadcast on Radio Essex with Dave Monk, I was actually with a psychologist then. He invited me on the programme. And somebody phoned in, and they had a problem with an anti-malaria drug. And it was only really after speaking to this lady that I began to think of something that had happened to me. I'd come back from India, and that was the summer that my daughter wasn't very well, and she was suffering because she suddenly stopped taking a very addictive sleeping pill, because we didn't have the information in those days that you mustn't suddenly stop these drugs. You have to withdraw really slowly. And unfortunately, I'd encouraged her really to stop, because I just thought they're not good for you, but had no information, because in 1995 we weren't given patient information leaflets. And it was only really after the radio program that I thought, why wasn't I coping? Because I wasn't really coping. I'd cope with most things. And I realised that I'd actually suffered a reaction to these anti-malaria drugs. Sometimes we're not aware ourselves. The family know, and maybe people at work know, and we start thinking other people have a problem, but actually we've got the problem. And it's very important that everyone around us is aware that when we take medicines, they should read the information, they should look it up, because, little early warning signs can happen, headaches or nightmares, that could actually help us to evaluate whether we need to take these medicines at all. So anyway, that's basically where I'm at.
Well, that's fantastic. Can I just share with you, because you're a recent listeners, so you won't have heard of my previous show. When I mentioned a letter from a listener, he had he'd been prescribed by his general practitioner medication to help him stop smoking. When he opened the packet, he said it was like origami. There was a sheet of white paper inside with all the adverse reactions and so on, and he opened it, and then opened it again, and then opened it again, and this small slip of paper suddenly turned out to be an A3 sheet of paper printed on both sides in very small letters with all the potential adverse reactions. And he was very frightened by this and was thinking, what shall I do? Because he wanted to stop smoking. He'd been prescribed it by his doctor, therefore it was safe. And he said, had the station, but he'd written to me through my Health Kick show to say, had I heard of any adverse reactions to this particular product? We didn't mention the product by name, but we invited listeners to suggest whether, in fact, he should go back to his GP and say, I'm concerned about this, or what he should do. And the overwhelming advice from other listeners was, go back to your GP. If you're not really satisfied that you've been reassured by these list of adverse reactions, which included at the end a rare risk of death. And you can win the lottery on 1 in 14 million chances, and I think it was something like 1 in 40 million was the potential for death. So, he was very stressed by it, I have to say.
Just first of all, the doctors don't know very much because, unfortunately, some of the doctors listening might think, what is she talking about? But I'm talking about the doctors in England from the point of view of medical education. Since 1993, the General Medical Council, which is a very important body in England, have a guideline on medical education, and it's called Tomorrow's Doctors. And in 1993, they took pharmacology and therapeutics out of the guidelines for medical education. And you're probably sitting there with your mouth open thinking, why? Well, I asked the person who was head of the GMC at the time, why? And he said, I don't remember. And that is what I come across all the time. A lot of really sad things that have led to people's deaths, or the doctors are let down, the medical students are let down. There's a professor in Edinburgh, Professor Simon Maxwell, and you won't mind me mentioning his name because he's working very hard and he's always saying, we need you, Millie, because he needs me to help support him. He turned up at a conference recently in London. We'll talk about this, I think, next time, because this was at the Royal Society of Medicine. And he was disappointed how few people turned up. It was 4 doctors. And because it was about drugs and can they harm your patients, I believe people are afraid to go because they think, I'll be tarred with the brush that I'm afraid I'm harming my patients. And this is what happens all through. Doctors don't discuss things. They don't turn up at meetings to discuss adverse drug reactions. I've held 3 conferences in London, and they have been amazing. The atmosphere has been amazing. The patients, or service users as we call them, we have to be careful what words we use, turn up, and they're so pleased to hear doctors and professors who actually listen and care and are concerned. And they've been amazing conferences. They've helped a lot of people. And in fact, 23 videos from the last conference are linked to the website on Vimeo. And you can just look in the menu on the left and click on the conferences. And you'll hear people like the chair of pharmacogenetics talking about how we can't all metabolize the drugs. So what's right for one may not be right for another. We might lack an enzyme that is needed to metabolize the drug. I can give you a statistic if you like. Do you like?
Please do. We like statistics on this.
Okay. Yeah. Well, there's a group of enzymes in the cytochrome P450 group, and I must impress on you, I'm not a doctor. I have no medical qualifications whatsoever. I left school at 15. My education is life. So I just want to make that point. Okay? Sure. But I did go to the Nuffield Bioethics meeting on genetics, and they said that the cytochrome P450 group, particularly one enzyme, CYP2D6, and you can Google this, is needed for 50 of the most commonly prescribed drugs. Now, this was a few years ago, so it might be needed for more now. And that includes antidepressants, cardiac drugs. Now, 7% I believe, of Caucasians, that's sort of white people from Europe, although I don't know how they can discern because we're all mixed now. We've all got bits of different, I certainly have different groups in me. Anyway, 7% of Caucasians, they reckon, lack CYP2D6. And I don't mind, I can speak about this because it's on the internet and it's public. A little boy in America died. He was given Prozac. His parents were going to be accused of murdering him until they tested him and they found he lacked this enzyme to metabolize the drug, and that's why he died. And in fact, one of the pharmaceutical companies actually used this story in a promotion of the test for CYP2D6, which they were trying to market. You know, they sort of patented it, which I think is wrong anyway. I think we should all have these tests, but I think at least people, families where they feel there is a history of adverse reactions should become aware it can be, not because necessarily that drug won't be good for somebody, but for them it won't be. You know, it won't help them, and it could harm them. Sure. And there's a very well-known clinical pharmacologist. His name is Andrew Herxheimer. You'll hear him on my website films. And he was editor of Drug and Therapeutics Bulletin, which is a bulletin given to doctors, used to be given free in England, but not anymore. I don't know why. But it analyses the medicines from an independent point of view. Because the trouble is, when the medicines are licensed, most of the clinical trials quoted have been actually funded by the drug company that produces the drug. And we could have a whole program on that.
Sure we will.
In fact, you might invite Dr. Ben Goldacre on because his book is all about this and about how clinical trials... He phoned me up and said, do you want me to speak at your conference about how clinical trials are rigged? And I said, yes, please. And he did. You can hear him on the website. But his book is just out. What's the political scene for you here in the UK? I mean, are you getting any interest from politicians or are you being cold-shouldered? Should we have another program on that? I think we need.
Or just
well, when I went to the House of Commons to the mental health forum, the lunch was paid for by a pharmaceutical company that produces a particular antidepressant. The meeting was about the mental health bill. I mean, I'll mention this as we're on this track about politicians, and the mental health bill was going to make it that sort of people could go in and drug you in your own home, give you an injection, and obviously more use of drugs. And I said to the secretary of this MP, I think that's really wrong that you had the lunch paid for by a pharmaceutical company, and there were pharmaceutical reps there, and there was somebody talking, even promoting one of their drugs. And they said, oh, but we wouldn't have had a nice lunch. I said, well, I got a sandwich out of the machine. It was absolutely fine. You know, the machine outside, this is in the big building next to the House of Commons. We know where the MPs have their offices. Yeah. Yeah. And there's another lovely MP there called Paul Flynn. The MP said to me, a lot of the meetings, many of the meetings are sponsored by the industry. I mean, the lobbying in the House of Commons is pretty blatant. The paying for lunches and just being there and putting on meetings. I went to one about Tamiflu, which is the drug for flu. Yeah. And that was sponsored by a pharmaceutical company. This is in the House of Commons, so there are some MPs who do care, but they're few and far between because a lot of people are career-minded, you know? And I think that's the problem.
As you say, that's probably a conversation for another day.
I think so, yeah.
Millie, thank you very much for sparing the time to talk to us today about April.
Yeah.
And can you just remind the listeners again of your website address?
Yes, it's www.april, as in the month, april.org.uk. That's april.org.uk. And that's because we're a charity, and charities are usually .organisation and not .co.uk. Have I made that too complicated?
No, I'm sure listeners will grasp that.
April.org.uk.
Okay. Millie, thank you very much indeed for your time today, and you've kindly offered to come back and talk to us again.
Absolutely.
I think the next time time you can come back and talk to us. It's about a conference that you've been to recently, and you've got some interesting stuff to share from that. Yeah. So we will talk to you again soon.
Okay, thank you very much for inviting me.
My pleasure. We'll speak to you soon, Millie.
Bye.
Bye-bye.